Welcome back to Your Carolina. Got to ask you, when was the last time you went for that regular dentist visit? We're going to talk with Dr. Daniel Nickles, and I have the utmost respect for him because that it really is what he went after in some of your advertisements as of late. And welcome, Dr. Nickles, to the show.
It's good to be here.
One of the things that people will remember seeing those commercials, how long has it been? Yes. And so I want to touch on that really quickly first. There's a lot of people who haven't been to a dentist in a while, right?
There's many people. I mean, most of the people you see walk into the practice haven't been in a while. They've had a bad experience at one point in life, and who wants to go back and have another bad experience?
Right.
Life gets busy. I mean, you know, time goes by, and how many times have you turned around and said, you know what? Oh my goodness, you know, a year has gone by. It's been 6 months. You know, when did that happen? Or you haven't seen friends in years.
Right.
But just like a regular doctor, we need a regular dentist we can trust, and you have such wonderful options at your office. You've shown us some of those pain-free ones.
Absolutely.
So for those who are just chicken about going to a dentist, and some wonderful new innovations and options that people who haven't been in a while really need to look at. Right. You've brought some examples of some of those.
One of the biggest things that I have had where, unfortunately, people who have not been in years, they end up, sometimes in bad shape, and they end up losing their teeth. Right. And then there are people who have lost their teeth in the past, and they suffer from what I call dentures. When dentures become an alternative to people, it's one of those things. At one point, if I've just got a denture, I've got a plate, and I place it in, and it flops around in my mouth. Right. And these people are miserable. They do not eat well. And a lot of these, unfortunately, end up going to nursing homes earlier than they should because they can't eat well. Their nutrition goes way down.
It's a cycle.
Exactly. And so one of the greatest innovations, and I call this 21st century dentistry, is just having a denture with 2, maybe 4 implants on the bottom. When you hold that up and let them see that.
Certainly.
And we place 2, maybe 4 implants in the patient's jaw. These are not, people think, oh, it's going to hurt, you can place something in my jaw.
Yeah.
Bone doesn't have any pain. I mean, doesn't have any nerves, so it feels no pain.
Right.
We take the teeth out, we just place these in. We place little locators on top, and we place a little something in a denture like this.
It keeps it in place.
Hang on, we'll be right back with that shot. Oh, just the slightest of clicks.
Now try to take it off.
And it's in there.
It's not.
I mean,
you're not. That's not going anywhere.
No. Now you can eat like you did before. The denture's not flopping around.
Those apples that you're
good to go.
And I've never worn dentures, so I can only go off imagining what it would be like. But all of those gooey, do you need those?
You do not need those anymore.
Okay. You know what I'm talking about.
Yeah, the little gooey creams.
It won't slip if you use this caulking in your mouth. So what a great option.
Absolutely.
And here's something, too, Dr. Nickles, that's kind of basic, but, you go to any store and you see a line of toothbrushes.
Yes.
It's, sometimes confusing. How do you know which one to get?
The best one. What is the best one? The best one is the one you're going to use.
Right.
Always look for the ADA seal. The ADA puts a lot of time and effort, and I have been to Chicago to the laboratories, and they have these machines that they try to pluck the bristles out. They see how long they're going to last, and they put a lot of time into trying to find out. So any toothbrush that has the ADA seal, most specifically one that has soft bristles.
Okay, soft.
And, a smaller head. The smaller the head allows you to get around. Your mouth isn't big. Some people have bigger mouths than others.
Right.
But just allowing you to get around in the mouth and just clean each tooth. The most important thing is, a small toothbrush, soft bristles, and brushing for about 2 minutes.
Okay.
These are kids that, sing their ABCs or the happy birthday song.
Happy birthday
song.
We have a
little timer.
Yes.
We have a little timer on our counter, and my little one flips it over and everything.
That's a great idea.
But that is where taking care of those teeth start, is training a young one. We have so many going back to school and such that you got to take care of when you start getting those permanent teeth. That's it.
That's it. That's your last set. That's your last set. So.
That's right. How long do you keep a toothbrush?
Toothbrush, 3 months max.
Okay.
Max. Now, if you have these toothbrush, you look at a toothbrush and it's just splayed open.
Throw
it away. It's only the end of the bristles that actually works. So if you're leaning on these things and you're splaying the bristles, you're just smearing the plaque back onto your teeth. Throw it away. Get you a new one. As far as what it does, to get the plaque and bacteria off your teeth, helping you prevent gum disease, which leads to heart disease, it's a couple bucks. Throw it away. Every 3 months, get a new one. I always tell people, I'll give you one in 6 months, and 3 months you buy one. We're going to just take turns every 3 months to get a new one. And, cold and flu season is probably coming.
Oh, yeah.
You get sick, throw your toothbrush away. It sits over the bacteria on it.
That's
You'll
a great
keep getting
advice.
sick
So you can
if
keep absolutely.
Now, you have done so much to help those overcome their fears, and so I want you, if that sounds like you, this is the guy you need to see, and I want you to tell them where they can find you on our way out here.
Okay, absolutely. I'm on Pleasantburg Drive.
Okay.
Nickles Dental, Nickles Dental at charter.net.
In the Lake
Or
Forest shop.
nicklesdental.com. And if you want to give us a call, Wanda and Penny are there now, 244-3211.
Guess what? It's right there on your screen as
Say
well.
hey to Wanda and Penny. We're going to be busy and taking
They'll be
appointments.
busy,
They
yes.
always are. Well,
Thank
thank
you.
you.
Thank you.
So much. Well, Dr. Nickles, I hope you stay tuned because we've got a really cool segment coming up next. It's a family, and they're playing bluegrass together. Wait till you see these kids. The Raven Creek Family Bluegrass coming up next.
All right. We've had bluegrass 2 days in a row. Such a great response from folks wanting to hear it. Have you noticed? I want you to kind of answer some questions for me. Blurry vision, faded colors when you look at something's not right with my eyes. Perhaps it's cataracts. Did you know that cataracts are the leading cause of vision loss in Americans 55 and older? There is a free cataract information meeting that is taking place August 27th from 10 until 11:30 at Southern Eye Associates. That's on Physicians Drive in Greer, South Carolina. Space is limited, and there's your contact information to get in.